I'm certified in many things, and one of the things I'm certified is in hyperbaric medicine. And it's an interesting tool that has been around since the 1600s, which is crazy to think about. It's not new. It's an FDA approved modality. We have tons of literature on it, but insurance doesn't really pay for it for all the uses like traumatic brain injury. If you're getting surgery for a knee replacement, hip replacement, or had a wound, it actually speeds your body's healing up. It increases your stem cells um, in low pressure, 1.3 atmosphere environment, not 1.5 or 2.0, increases your stem cell activity. There was an interesting study. I don't know if I mentioned this in the book or not. Who knows? Who knows? I've been talking so much these days, but where they took pigs in the 50s or 60s. I learned this in my certification. They put them at 3 atmospheres in a tube compression device. Uh, Took their blood out and replaced it with normal saline, and the pigs just did their pig thing, hung around, oinked, defecated, peed, and ate. They did that for a couple hours. They put the blood back in, brought them back to 1 atmosphere pressure, and they were 100% fine. And the point of that study was, which we wouldn't be able to do today, right, is that you can overcome having no blood in your body just with oxygen and pressure, which means if you're old and you have stroke, you can bypass the blockages. If you have heart issues, cardiomyopathy, you can bypass the blockages or get new stem cells to grow. Hyperbaric is such a powerful tool, and we have literally dozens of things just like that that are being left unused for people who could benefit from them.
Yeah, we've had a couple guests with hyperbaric, and I feel like I've missed the boat on hyperbaric because my dissertation was on hyperoxic training. And so we've had several guests on here that have either, the more hyperoxic type of treatment and training. And then we had Will Peoples, who Will was he was on the U.S. Olympic bobsled team for, I believe, 7 or 9 years. Numerous concussions. I mean, his brain is just beat to hell because of all the concussions that the USOC just ignores, denies, whatever you want to look at it. And he has found, the best treatment for him has been in hyperbaric training, or the hyperbaric chambers. And so he's on kind of a quest to try and get that type of treatment available to, our military who have had traumatic brain injuries, athletes, and so many people that can really benefit from that.
And you can also, I have some patients that are, professional football players and other kind of high level athletes, race car drivers, et cetera. And you can use it as a preventative as well. Mm-hmm. For example, if you're a front lineman playing football, they've done MRIs of people who, and some of them actually have their own chambers they take with them when they travel to games. And they do it routine, like 5 days a week, right? And you're doing it as a preventative and then as a treatment. And they've done MRIs on people's brains, professional football players, and you can see just literally the average person can see a difference in the brains. From those, you can literally go, which person you think is using the MRI? I mean, the hyperbaric, and they can tell. And so you can use that as a preventative. You can use it as a treatment. There's an interesting research going on in Israel with using hyperbaric for race car drivers. Because when you're driving, 200 miles an hour, like literally a tenth of a second is the difference between crashing and being number one. And so all of a sudden, that memory, that higher executive function, and you can actually improve that with being in a chamber and then basically doing eye saccades, eye movements, like guided imagery of the race, because it basically increases blood flow to those parts of your brain. So you can use it as a performance enhancer as well. So it has so many utilities. There are some things you got to be careful with. You can get oxygen toxicity, which if you do it right, it's kind of hard to do. But you know how people are. People, if a little's good, more is better, which is not the case with many of these things. But it's one of those things that, it's in the average physician, average practitioner. How many people get in car accidents? How many people ride a roller coaster and they're dizzy for 3 days afterwards? I had one patient that was in Home Depot. She sat up, hit the back of her head in the open door, and she was dizzy and had memory issues for 6 months. The average practice is not going to recognize these small micro concussions or small, whatever you want to call them, and treat those. And this is what worries me, is there's a kind of dementia which is related to traumatic brain injury. You may be familiar with the movie, I think it was Concussion. Was Will Smith in there? And it basically was talking about chronic traumatic encephalopathy, CTI. That is, you get injured, and the inflammatory process does not stop. Muhammad Ali, you could tell at the end of his career was having issues, but his diagnosis, I think, was 3 years after his Parkinson's diagnosis, after retired, you can actually stop that degeneration with hyperbaric. And so there's so many uses for it in so many different places. It's just people need to know about it and then apply it.